The Casa Teen Clinic in Forestville is the main resource in our community for teenagers to find information about sexual health and contraception.
My name is Shari Kovner. I'm a nurse practitioner, and I'm one of the 2 nurse practitioners that work at the clinic. We switch off days, and I see teens for family planning, Plan B. I do exams, I do STD testing, and answer questions.
Well, I became a nurse when I was 24, and I started working at the Occidental Area Health Center about 11 years ago. And the teen clinic, I believe, began around 2000, so about 8 years ago. I think I started getting involved about 4 or 5 years ago. And it moved here to this site about 4 years ago, I think.
So how did you hear about the teen clinic?
I heard about the teen clinic through when some volunteers came to my English class and told me about it.
I remember seeing it in the daily bulletins at school about how to get there and the sort of stuff they provided and things like that.
I had heard about it just like through the grapevine around campus, and they were having a volunteer night, and I thought it would be fun to see what it was like.
I knew about it from some friends in my sophomore year, and I kind of just asked around, is there any way I can help?
One of the old volunteers, Maddie, told me that they needed people, and she brought me an application. And I filled it out, and I was hired.
What is the appeal of the Forestville Clinic for teenagers?
I really liked the atmosphere at the clinic. It was really welcoming and just looked really fun, and I just really wanted to be able to educate my peers on things that I feel that are really important for them to know.
It was just like really comfortable atmosphere. Everyone was really nice, and it seemed like a really good cause because my freshman year I really only had like abstinence-only education and some like STD scare tactics. So
the teen clinic in Forestville is somewhat unique because local teens volunteer their time. The volunteers have a variety of responsibilities.
I just kind of hang out in the waiting room to make sure that there's always someone in there, so no one's sitting in there alone. It feels like everyone knows who they are and what they're doing there.
I'm the receptionist of the teen clinic, so when you come to the teen clinic, normally I'll be sitting at the desk, so then I process the paperwork and get the patient ready to be seen by one of the nurses or nurse practitioners. I also go out to the schools and do teen clinic presentations.
I do counseling, and I do visits with the patients, but I do not do exams, physical exams. The nurse practitioner does that.
In general, the government funds mostly abstinence-only or abstinence-based sex education in schools. We asked if these programs are effective in educating teens to make healthy choices.
That's completely ridiculous. Abstinence is the only completely safe method, but it's also preposterous to think that teens and, young people are going to completely go without sex because it's such a raging desire in their young bodies. They can't help it.
I remember getting like a brief overview of like STDs and abstinence only my freshman year, and then it's kind of like eradicated from the curriculum. And I think the only time that we do have sex ed presentations is when the teen clinic volunteers come to the school and do it in different health classes or science classes.
I think that, overall abstinence is a good thing because that way you don't have to deal with all of these stressful issues like pregnancy and how to get tested for an STD and all of that. But it is true, it's the only way to keep yourself completely safe.
I think that abstinence-only education is not useful at all because we're teenagers, and teenagers have sex, and that's just like the way it is. It's nature, it's built into our bodies, it's hormones, and telling people that they shouldn't have sex and that it's wrong and that it's bad isn't going to stop teenagers from doing it, because teenagers are all about rebelling. And so the safest thing is to teach them how to be safe.
I think that abstinence only it may be a nice ideal, but I think it's really unrealistic for teens. I think that not very many people are abstinent, and that's okay if you want to be, but I think that the majority of teens are not abstinent, and even if they are abstinent currently, I think that everyone should have information to make a healthy choice about their bodies and not be given this mantra that sex is bad, sex will make you die.
So if teens aren't finding the information they need through school, what sort of services and information can they find in the teen clinic?
We provide family planning services, which include STD testing, pregnancy tests, birth control.
We also tell them how to protect themselves in the event that they do choose to have sex.
We try to do presentations to classrooms.
We talk about all the different methods of birth control, hormonal versus non-hormonal, and Plan B is really important. We talk about we talk about STDs and when to get tested and how to get tested. We don't really go into all the symptoms and the scary oozing stuff.
Exams, pap smears, basic health, sexual health, medical care.
They definitely come with a lot of misinformation about when their fertile period is in their body, in their cycles. Women don't really understand when they can get pregnant, and we see a lot of information about birth control pills, and we sometimes we see teens who don't really understand that it's medication, that they sort of come in and go, I want birth control, and they have to sit there and explain, well, there's lots of different kinds of birth control, and there's important that we talk to you for a while and you understand the side effects.
The Teen Clinic provides a confidential place for teenagers to find information about sex and sexuality that they may not be able to find elsewhere.
If that information wasn't available to them, then I don't really know where people would go. Like, it's awkward to ask adults, for that information.
The fact that it's free and that it's confidential, so no one's parents ever need to know, which I think is probably a reason why some people don't go and get help or get tested, is because they're afraid that their parents will find out. And, that's not an issue with the Teen Clinic.